Hi, everyone. This is Sean with the MassSupport Network here with COVID-19 update for Friday, April 30th, 2021. Well, things are going in different directions in different places. Worldwide, we've crossed 150 million cases of COVID. That is over 6 million more than we saw last week. That is a record high for new cases in a single week. Here in the United States, we saw 366,000 cases, which is actually about 60,000 fewer than the week before. Here in Massachusetts, things are also declining as we saw 9,000 additional cases, which is 2,000 fewer than we saw last week. In terms of deaths worldwide, there were nearly 100,000 new deaths in the last week. But elsewhere, they are saying the same, we're trending downwards. The United States saw about 5,000, about where it's been, maybe slightly less. And Massachusetts lost 79 additional people to COVID-19, which is 4 fewer than the week before. When we look at the trends here in the United States, you can see that things are continuing to head downwards still. Not as sharply as February, but we are moving down to the 50,000 a day mark on average. That is significantly less than we were during the summer surge, which is good. Not yet where we were during the fall lull there. We were probably about where we were in late summer or maybe early October of last year for the country. Looking around, that is still a lot of spread in Michigan, not as much as there's been in the past. It does seem to be trending downwards there at least a little bit. But other places, there are pockets and other states starting to rise somewhat. When we look at hospitalizations, though, that has begun to dip, which is a good thing because as hospitalizations go down, that's going to make less pressure on the hospital system and making fewer deaths from shortages. So we are definitely below where we were at the end of the summer peak, which is good. Still a long way down to go, though. We are still much higher than we were for hospitalizations than during the fall lull. When we look at new cases coming into hospitals, that has dropped a little bit more significantly, though, of course, the last couple of days data is always a little bit uneven, but still progress in the right direction, if not quickly, though as cases continue to fall, the hospitalizations will fall in a few weeks after that, as they are a lagging indicator. And deaths are also, generally speaking, on a downward trend. Again, these do go even further after cases than hospitalizations, but in terms of deaths, we are certainly below the summer surge and not too far off from where we were in the earlier parts of the fall. Okay, developments. One of the big ones is that Massachusetts has announced some reopening guidelines for the coming weeks and months. We're easing some restrictions. Starting today, outdoor masks are no longer required in public areas if you are able to keep 6 feet of distance, which is good. Just one little bit of making things a little bit easier for people. After all, with over 2/3 of adults in this Commonwealth having received at least one vaccine and something like 45% having been fully vaccinated, outdoor transmission is very unlikely. Also on May 10th, a number of things will reopen, including things like sports tournaments and road races, outside events that are likely to be low risk at that point. And actually singing inside is going to be allowed again with very strict guidelines, of course. On May 29th, parades will be allowed again at reduced capacity and bars will be able to reopen. Finally, on August 1st, big important thing, ball pits reopen. Also things like nightclubs, dance clubs, saunas, that kind of thing, but ball pits was in the list and that is funny. So all of these, of course, are conditional on the fact that the trends are still going in the right direction, that cases remain low, get lower than they are right now. So any of these could be walked back later. But this is the rough outline of how things were. So you can remember from last year, the summer was a fairly light time in Massachusetts. So it should be even lighter this year with so many vaccines out there in people's arms. So hopefully this is a roadmap that will remain more or less accurate, as Massachusetts will at least get back to some semblance of normal. Other places in the country may not be able to do that as safely as we can because they're going to be in warmer areas where people will be driven inside by the need for air conditioning, or because they just don't have as many vaccines out as we do. You can find these sources from our data at the New York Times, mass.gov, and at the CDC. And for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.